thank you for joining us today, and we appreciate you spending time with us. Today, we have a very special guest, and we have Dr. Vincent, who's one of our medical officers at Pediatric Partners Hospital. He's going to be talking about Scfe. For some of you who do not know what that is, it's actually when children have what we call a slipped capital femoral epiphysis. And basically, it's a dislocation of the hip bone. So he's going to give us more information about that. Dr. Vincent, thank you for being here, and take it away.
All right. So just like we've established, I'm talking about slipped capital femoral epiphysis, in short for SCFE. So basically, this is a condition that happens when the head of the femur, which is the ball part of the femur bone, slips out of the containing acetabula. That's its fusion point in the hip joint. Now, this is a common condition that happens in children, usually at the ages of 8 to 15, and it's more common in boys. Okay, so when this is happening, you notice your child will tell you, mom, dad, I'm having a growing pain, or you notice they are limping, or they're not bearing full weight on that particular leg. They could also complain of pain on the thigh, anteriorly. So at this point in time, you should take your child to the hospital, where most likely the doctor will request for some investigations, which would include an x-ray of that hip joint. Okay, so we do have some risk factors to this condition, and these risk factors include obesity. So you should always be mindful of what your child is eating and watch their weight to prevent this condition. This also happens during growth spurts. That's when your child is experiencing a growth spurt. Because of rapid growth, this head can slip. So when you get to the hospital, you do the x-ray, your doctor will, take a look at it, and then this is just to establish how bad the condition is, so to say, because we could have a stable one and we could have an unstable Scfe. So the stable, well, treating it usually is just bed rest, and then sometimes they may do a minor procedure, a non-invasive procedure, which involves pinning. That's the passive pin, and then hold the head of the femur in place to prevent it from further slipping. Also, we could have the unstable one, which sometimes may already present with some complications. That one will involve an open reduction surgery, which is performed by the orthopedic surgeon. So some complications that we will want to avoid includes what we call avascular necrosis. Now, this is when the head of the femur has slipped off and then maybe has pressed down on some blood vessels, and the blood cannot get to the head of the femur, and you notice the bone starts to degenerate. Some other complications could be chondrolysis. Just like I said, this degeneration of the bones. And then you could also have what we call early onset of osteoarthritis. So early identification of this condition is very important to help give your child the best possible care, and then also give them a good shot at a normal life while they are growing. So you should just pay more importance, especially to your children at that point in time when they're growing, and then pay very good attention to their diet. Some also children could be at risk of this, and these are children who may have some issues with growth hormones, and some children who may have some endocrinology issues that may cause them to gain excessive weight. So basically, early detection of this condition is key. And then if you notice that, just encourage your child to have more bed rest and then less physical activity at that point in time, in order not to complicate the condition. Okay, so basically, in a nutshell, that's a parent education about Scfe. Thank you.
All right, thank you. Dr. Vincent did his research, obviously, because I wouldn't have been able to do it as detailed as that. And Dr. Tommy, do you have any questions or any additions to? to add?
Okay, I saw a child. I think I might have seen a child that has like Scfe in PPH because he had surgery. But then the thing about it is that I think by the time he came in, he was already limping. So now, like after the surgery, he's still limping, uh, so parents will just know that if it has happened for a long time, if the child has been limping for a while before you come in, the limping might continue even if the child no longer feels pain at the hip, yeah, it might continue. And I think the thing that the parent told me that helps the child is swimming. So physiotherapy, obviously,
Yes.
yeah, it helps. And the recovery time might be like a bit lengthy, but like
Yes.
it would eventually like be corrected. That's just all I have
Yeah,
to say.
most times when children are limping and they've had it for a while,
Mhm.
it can take a while for that limp to go away, but it eventually goes away.
Mhm.
But the goal is to also bring that child to a point where they have lost so much weight that they are more confident on their feet, and then physical physiotherapy, long-term physiotherapy usually helps. But if a child is still limping after the surgery, that's not the ideal. They should not be limping anymore, especially it's like anytime you break a bone, you're going to limp because you've had pain. But once the bone is healed, there's no reason for you to limp anymore. So a child like that should really be continuing with the physical
Yeah,
therapist.
it's
Yes, and be followed very closely by orthopedic surgery too.
yes.
Yeah, but this is extremely important because I had a child actually in my career since 1997. I've seen when I was in residency, we saw a lot because we were in children's hospitals, and now I'm still in a children's hospital system. But in my career, I've seen maybe and managed maybe only about 10, and they were all boys, and they were all overweight, and some of them were like 9 years old, 10 years old. The range, like you said, 9 to 14 years old. And the last one I saw was quite significant because he had had the hip pain and he had had it for a while. And it was only after it had slipped completely and broken that he was now taken to the hospital. But there was, because it happened so quickly, they were able to actually take him within 24 hours. He was in the operating room. And you see, like, this is your hip bone,
Yes.
and this is the head, and it slipped down.
Yeah.
So they put it back up and put a pin through the hip bone. We're going to show pictures of that as part of this talk so that parents can get a good idea of what we're talking about. But that is a condition. Anytime a child is limping, we always take it seriously because the limp can be just, okay, muscle, it can be a bone, or it could even be cancer.
Yes.
So that's why when
True.
patients come in and they have a history of limping, oh yeah, he's been limping for 2 or 3 weeks, that's not normal. We usually like to do blood work because that's how leukemias are picked up. So in the limp, you can get a lot of information. And this avascular head of necrosis, I've never seen it before just because it's been taken care of very quickly and for the patients I have seen. And it's extremely important. If your child is limping, bring them to the hospital. We'll check their blood, we'll do x-rays, we'll make sure that they don't have leukemia, which is the worst thing that it can be. And then we'll also make sure that they don't have these dislocated femoral epiphyseal bones, which is very, very important. So I think it's a very, these topics, wow, you guys are blowing it all away with all these good topics that you've brought up. So we really appreciate that.
Yes, ma'am.
Thank you so much.
you, ma'am.
Thank you, Dr. Vincent. Thank you,
Yes,
Dr. Aluko.
Thank you.
And thank you, parents and viewers, for being part of our listening audience. We really appreciate your time. If you have any questions, please go ahead and send questions through the links at the bottom of your screen, and we'll be happy to see you if you're in Lagos at Pediatric Partners Hospital. Thank you and have a good one. Bye-bye.
Bye.